Hello, today I'm going to be presenting my PowerPoint, which is Understanding Eosinophilic Esophagitis. So, the introduction of eosinophilic esophagitis. Eosinophilic esophagitis is a chronic immune mediated inflammatory condition of the esophagus that has increasing attention due to its rising prevalence and significant impact on patients' quality of life. It is characterized by eosinophilic infiltration into the esophageal mucosa. EOE can lead to symptoms such as dysphagia, food impaction, and chest pain, which often mimic other esophageal disorders. This condition mainly affects individuals with allergic predispositions, such as asthma, eczema, or allergic rhinitis, and is triggered by dietary and environmental allergens. Without early intervention, EOE can progress to severe complications like esophageal strictures and persistent symptoms. This paper explores etiology, epidemiology, progression, genetic and cultural consideration, and current prevention and treatment strategies, with a focus on research aimed at improving diagnosis and management across the lifespan. So, the etiology and significance across lifespan. So, EOE is an immune driven condition that occurs when the body reacts abnormally to allergens, resulting in eosinophils infiltrating the esophagus and causing chronic inflammation. Common dietary triggers include cow's milk, wheat, soy, and nuts, while environmental allergens can also contribute. A genetic predisposition and a history of allergic conditions like asthma or eczema further increase the likelihood of developing EOE. The condition can affect people of all ages, and the symptoms often differ depending upon the individual's age. For example, children with EOE may struggle with feeding difficulties, vomiting, or poor growth, while adults are more likely to experience difficulty swallowing and food getting stuck in the esophagus. So, epidemiology and incidence prevalence. Eosinophilic esophagitis affects an estimated zero point 0.5 to 1 in 1,000 people. It occurs more frequently in males than females and is often linked to personal or family history of allergies. Prevalence tends to be higher in North America and Europe, which may be due to better awareness and improved diagnostic methods. Children generally show slightly higher rates of EOE compared to adults, likely due to factors like dietary allergens and genetics. So, progression and natural history of the disease. Eosinophilic esophagitis develops when allergens trigger an inflammatory response, bringing eosinophils into the esophageal lining. This ongoing inflammation can lead to tissue remodeling, fibrosis, and eventually esophageal strictures. Early symptoms, such as mild difficulty swallowing, may worsen over time, progressing to severe food impactions or persistent pain. If left untreated, the structural damage caused by EOE can become more challenging to reverse, which shows the importance of early diagnosis and prompt treatment. So, existing prevention strategies. Preventing eosinophilic esophagitis involves minimizing exposure to known allergens, identifying food sensitivities early through allergy testing, and elimination diets can help reduce inflammation and slow the disease progression. For children, breastfeeding and introducing a diverse diet early may decrease the risk of developing food allergies and EOE. Additionally, raising awareness among healthcare providers and patients is important for early recognition. So, therapeutic measures, pharmacological and non pharmacological. The management of eosinophilic esophagitis involves a combination of dietary, pharmacological, and procedural approaches. Dietary therapy, such as a six food elimination diet, effectively reduces inflammation by eliminating common allergens, with supervised reintroduction of foods to identifying triggers. However, this approach requires long term adherence and monitoring for potential nutritional deficiencies. Pharmacological treatments, including topical corticosteroids like fluconazole and budesonide, are widely used to reduce eosinophilic inflammation, while proton pump inhibitors not only alleviate symptoms but also provide anti inflammatory benefits. Emerging biological agents such as dupilumab are showing promise in clinical trials. In case of severe esophageal strictures, procedural therapy such as esophageal dilation may be necessary, though it carries risk, including perforation. Cultural and sociocultural considerations. Dietary habits can vary across cultures, which can impact both the prevalence and the management of eosinophilic esophagitis. In regions where diets are rich in common allergens, like wheat or dairy, there may be higher cases of EOE. Additionally, socioculture factors play a role in healthcare access and ability to stick to a restrictive diet. An example is some patients may face challenges due to the cost or limited availability of suitable alternative foods. To effectively address these barriers, is it important to provide culturally sensitive education and develop tailored interventions for each patient. Genetic considerations. Genetics play an important role in the development of eosinophilic esophagitis. Research has found a link between EOE and specific genes, such as the CAPN14, which is associated with the function of the epithelial barrier. The tendency for EOE to run in families further supports a genetic connection. Although the exact process involved are still being studied, gaining a better understanding of these genetic risk factors could pave the way for more personalized treatments and a targeted prevention strategies in the future. So, current and future research. Recent advancements in treatments of eosinophilic esophagitis are focusing on biologic therapies that target cytokines involved in eosinophilic inflammation. Promising results from clinical trials of agents such as dupilumab and benralizumab have demonstrated significant reductions in eosinophilic counts and improvements in patient symptoms. As well, research is advancing the development of less invasive diagnostic tools, including biomarkers like eosinophil derived neurotoxin detected in blood or saliva. Longitudinal studies are also underway to evaluate the long term safety and efficiency of these new therapies, offering hope for a better management of EOE. Conclusion. Eosinophilic esophagitis is a complex, chronic inflammatory disease that presents significant challenges throughout the lifespan. The condition is driven by an abnormal immune response to allergens, resulting in progressive tissue damage and substantial impact on quality of life. Early diagnosis and multidisciplinary approach to management are needed for preventing complications and improving outcomes. While current treatments such as elimination diet and corticosteroids provide symptomatic relief, advancements in biologic therapies and diagnostic tools are paving the way for more effective care. Additionally, adding cultural, genetic, and environmental factors in treatment plan can also create a more well-rounded and personalized approach, ensuring the better care for the people with this condition. So thank you for listening to me today.